Medical records management. Types of medical records. Problem-oriented medical record, POMRs, identify problems numerically as listed by patient, readily identifies frequency of recurring problems, and nearly always uses SOAP or SOAPer for progress notes. SOAP standing for subjective, objective, assessment, and plan. The ER for education and response of patient to the education. A source-oriented medical record, SOMR, groups information chronologically and by source. It makes it difficult to quickly access a patient's clinical picture, however. Some equipment and supplies, vertical files, open shelf lateral files, this is what you see in a lot of offices, movable file units, file folders, and identification labels. Guides and positions. They're used to separate file folders, a single caption and a double caption entry. An out guide is a piece or a cardstock or plastic paper sheet kept in place of the patient's chart when the chart is removed from the filing storage. It can have information on it such as who took it out and when they took it out, so that you know where to go look for that file if you're looking for it. Basic rules for filing. Alphabetizing is a key to organizing files and charts. Rules facilitate alphabetic processing in maintaining files. Indexing units. Annette Barber Samuels. Unit 1 is Samuels, being the last name. Unit 2 is Annette. Unit 3 is Barber. Steps for filing medical documentation in a patient's file. We use inspect, index, code, sort, and file. Inspect is carefully inspect the report to identify the patient, the subject, or the file to whom the information belongs. Remove any clips or staples. Make certain the information is complete. Index. Use the indexing process to determine how the chart should be located, properly identifying the index unit and their order. Code. Coding in the medical record is the process of marking the data to indicate how information is to be filed. Sort. If there is any number of reports documents to be filed, sort them into units according to the caption on the chart. And file. The papers are placed into the proper chart and the chart is returned to its proper place in storage. Filing techniques and common filing systems. Alphabetic is an intrinsic to all methods. Color coding is used higher percentage of the time. Numeric is used in very large facilities, ambulatory care settings, and hospital systems. And subject filing is often used for business records. Color coding. There are many types of systems. They usually have an alphabetic base. They're customized coloring coding systems. You have Tab Alpha, Alpha Z, and customized color-coded systems. In numeric filing, the components of numeric filing are serial number dividers with guides, miscellaneous or general numeric file sections, alphabetic card files, accession records. Choosing a filing system. Consider the type, the purpose, and the use of the information. You want to take into account the number of files or records that your facility has, and you also want to make sure that you recognize the need for confidentiality. So if you're a larger facility, maybe numeric filing is the way to go. Filing procedures. Cross-referencing. It helps store files for quick and accurate retrieval. It's especially helpful with foreign names, hyphenated names, and step families. It should be simple. The steps for cross-referencing are identify the primary filing label, make a proper file to be used as the primary location for all medical records, identify one or more alternatives where one might find the file, And for alternative filing, make a cross-reference sheet, card, or dummy file that lists a primary reference or refers back to the location of the primary file. There are many examples for rules of cross-referencing in your book. Tickler files in a manual system or calendar reminders in an EMR system. A reminder that action needs to be taken. It should contain the patient's name, the tickler date when the action should be taken, the required action, and additional relevant information. A tickler file is just basically a reminder system. In an electronic medical record, it would be like a pop-up saying this person has an appointment at such and such a time with such and such a doctor. If a patient makes an appointment 6 months out, maybe a month ahead of that appointment, you may have a tickler file for sending cards out to remind the patient that they have an appointment coming up. Release marks. Providers may use their own initials as release marks, saying that they have seen a document. These are good quality control measures to make sure that a physician has seen the report that you have left on their desk. A checkout system. Outsheets or outguides that we had talked about previously. A list of information that should be included on the outsheet. Locating missing files or data. Misfiling can occur for a number of reasons. When the situation occurs, a specific procedure must be established to conduct a search for missing information. By conducting a systematic search, the missing data usually can be located. Some steps to searching. Check all the items within the file. Check other files with similar labels. When trying to locate missing files, check the file folders before and after the proper location of the misplaced file. Look at the folder with similar labels. Check the provider's desks, the trays, and within the office personnel. If using a color-coded system, look for folders with the same color coding or missed files. If using numeric systems, look for possible transposition of numbers. Check for transposition of first and last name, and check for alternative spellings of the name. Filing charts and data. Types of reports that would go into a file. Clinical notes, correspondence from other doctors, laboratory reports. Miscellaneous items might be related to insurance, requests for transfer of medical records, personal notes from the patient. Retention and purging. As information accumulates, it is necessary to maintain files by the process known as purging. Purging can involve several forms of action. Record purging requires sorting through records and removing those that are not active. Each facility should establish a standard policy and control and processing of those records. It may be 3 years and before. Active files include records that need to be readily accessible for retrieval of information. Inactive files consist of records that need to be retained for possible retrieval of information, files not currently being accessed for information. And closed files are those that are no longer required. Again, the patient files that retain for significantly longer periods of time because of litigation or research considerations, 3 to 6 years beyond the statute of limitations. Filing procedures for correspondence. Remove paper clips and staples items. Inspect to see if the item is ready to be filed. On incoming correspondence, be sure the letterhead is related to the letter. On outgoing correspondence, look at the inside address and the reference line. On incoming or outgoing correspondence, code indexing units of the designated label. Create a miscellaneous folder for items that do not have enough in number or to warrant an individual folder. Electronic medical records. The costs are high, but money is saved in transcription and labor costs, copying expenses, and malpractice insurance costs. Purchased as a single computer application or part of a larger practice management system. Some clinics purchase a total practice management systems in steps. EMR can perform numerous tasks. Electronic medical records require that the provider and all staff members use the computer for viewing charts, writing prescriptions, creating progress notes, recording laboratory results. They may very soon respond to voice recognition rather than keyed entries. Confidentiality and privacy must be assured when using electronic medical records. It is essential that the system is backed up to ensure availability of charts. Confidentiality. The medical assistant must always maintain confidentiality. It is never appropriate to discuss any information outside the clinic unless authorized to do so. There's no discussion of patient information within the facility when not your concern.